It's an international emergency, according to the World Health Organization, but so much is still unknown about the latest outbreak of an Ebola strain in Central Africa. Officials have only reported 88 deaths, but there are hundreds more suspected cases in the Democratic Republic of the Congo. And there's no vaccine. There's concern about the rapid spread of the virus. It's now appeared in neighboring Uganda. The medical aid group, Doctors Without Borders, is preparing what it calls a large-scale response.
Dozens of deaths in the Democratic Republic of Congo's Ituri province are already linked to the latest Ebola outbreak. Officials announced it on Friday, weeks after cases appear to have begun.
We are very afraid. Since the beginning of May, many people have died, and it keeps happening. We are very afraid. If someone has a headache, a fever or a stomachache, they die after a while. There was a young man nearby who was under 30 and arrived in the village yesterday. Today we heard that he has died.
Ebola is highly contagious, spread via bodily fluids and has a high fatality rate. Health authorities have confirmed this outbreak is caused by the rare Bundibugyo strain, for which there is no vaccine. Cases have now been reported hundreds of kilometres away in Congo's capital Kinshasa and across the border in Uganda. But with the outbreak largely in remote areas, few samples have been lab tested. The World Health Organization says the spread may be much larger than what's being detected, with local health officials warning the areas affected are already struggling with conflict and displacement.
It's an epidemic that will spread very rapidly. All the more so as it has broken out in a densely populated province with a high concentration of people and a great deal of population movement. And then, of course, there is the added complication that there are many armed groups in this province. That is what will make managing this epidemic very, very, very complicated.
The WHO says the outbreak does not meet the criteria of a pandemic like COVID-19 and is advising against closing borders. But it's urging international cooperation to urgently stop the illness spreading.
Right. Kai Kupferschmidt is a science journalist. He told me why Ebola keeps breaking out.
It's one of those diseases that we know is carried by wildlife. We're still actually not sure for some of these strains like Bundibugyo, which animals exactly carry them. But so spillover keeps happening, and they probably happen more often now than they did in the past, partly because there's more interaction between humans and wildlife as we encroach on nature. And partly we're getting better at picking up these signals also. Places that used to be very remote and maybe there might have been an outbreak in the past we wouldn't even hear about are now so well connected that these things travel and they also become bigger and they are detected. So there's a lot of reasons why Ebola isn't going anywhere.
Well, that doesn't sound like good news. We already have confirmed cases in DR Congo and Uganda. What are the chances that it keeps spreading?
I mean, that's what everybody's trying very hard now to find out, right? Remember, the first confirmed case was actually confirmed this Thursday. So there's only been a few days and people are, trying very, very hard now to trace back, okay, what are the earliest cases that we can actually find? Who are the contacts? Where else might people have traveled? Where do we, where else are we seeing cases, suspected cases? We already have one case confirmed in Goma, for instance, in North Kivu. So it's not just the Ituri region in DRC. And this is going, in the next few days, we're going to learn a little bit more about this. And so also it might look like the virus is spreading, but in reality, it already spread in the past, and we are now retracing its steps, trying to catch up to the present in a sense. Because what you really need to do in order to stop this outbreak is you need to figure out every person who is sick with Ebola, get them into isolation, figure out everybody that they had contact with, and then quarantine these people. And that's how you traditionally stop an Ebola outbreak. I mean, the DRC, this is the 17th Ebola outbreak in the DRC. No country has more experience with this.
Right. The WHO says this outbreak does not meet pandemic criteria, but has declared it a public health emergency of international concern. Look, What's the difference and how close are we to a pandemic?
Right. So understandable after the experience we've all gone through with COVID that people are really worried about pandemics. But I think this framing really isn't very helpful. I think we have to realize that just as there were a lot of health crises before COVID-19 that were really concerning without ever becoming a pandemic, we are now back in a world where that happens, right? A public health emergency of international concern is essentially a way for the WHO to say this is a really serious outbreak that could have at least regional consequences. There's a risk of international spread, and it gives the WHO a few tools in order to make sure that countries work together against and take this threat seriously in order to make sure it doesn't spread further. To be very clear, Ebola is not the kind of pathogen that I would worry about spreading, say in Berlin or New York. It's transmitted through bodily fluids, and the situation we're seeing in the DRC in particular, this is happening in a region where there's a lot of armed conflict. There's very low resource setting. There's very little healthcare. So there's the conditions for spread there are very different from elsewhere. And so I think it is really important for everybody to realize that there's reason to be really concerned about this, but that doesn't mean that this has anything to do with a pandemic.
Right. I mean, as you said earlier, there have been several outbreaks before. What makes this Bundibugyo strain particularly hard to stop?
I don't think this strain is per se harder to stop than other Ebola strains. I think the problem here is that the most common strain of Ebola, or really species, is Ebola Zaire. That has caused most of the outbreaks in history. And that is what most of the diagnostics have been geared towards. So what happened here is that there's been a delay also in just detecting this outbreak because some of the early diagnostic tools that were used, the gene expert machine, are actually geared towards Ebola Zaire. That means that the outbreak grew bigger than it probably would have otherwise, and that now means it's harder to stop it. There's more contacts to trace, there's more cases to find, all of these things. So that is what makes it harder. And in the long run, it is a little bit harder. We don't have a vaccine here. For most of history, we haven't had vaccines either for the other Ebola strain. So there is experience with stopping these outbreaks without a vaccine, but we also need to make sure that we get diagnostics into the country, into this region. And that's not going to be easy because it's just a little bit, less common. And so there's less kind of easy to use point of care diagnostic tests that can be distributed.
Thank you very much for that. Science journalist Kai Kupferschmidt. Thank you.